Hi everybody. The purpose of today's video is to go through the processes and procedures for taking a goniometric measurement of passive range of motion of a joint. I'm going to use a 12-inch goniometer. So as a quick reminder, the basic parts of a goniometer are the fulcrum, which is the middle, the movement arm, and then the stationary arm. Today, I'm going to show you the processes for taking goniometric measurement of elbow flexion. So before we ever put a goniometer even next to a person's joint, there are some steps that we need to do first in order to make sure we're taking an accurate measurement and getting a complete clinical picture. So for elbow flexion, we're going to assume today that Lisette's left arm is her impaired side, and that's what she's seeing us for. So before we even assess the left side, I want a comparison with the unaffected side. We're going to start with assessing active range of motion of elbow flexion. So Lisette, if you wouldn't mind, would you mind taking your hand and bending your elbow up towards your shoulder? Good. And keep your elbow down on the table. Why don't you go ahead and do that again? Great. Good. So she looks like she has full active range of motion on her unaffected side. Lisette, I'd like you to do the same thing with your left arm. Just bring it up as much as you can towards your shoulder. Is that as far as you can go? Mm-hmm. Okay, and bring it back down. Good. It's important to ask if that's as far as the individual can go, because sometimes if they are having pain or if they're nervous to move through that range of motion, it may not be the full motion that they're demonstrating to you. Now I'm going to assess the passive range of motion. I'm going to do that again on the unaffected side first, and then on the affected side. Part of the purpose of assessing passive range of motion is to see if there's a difference between active and passive range of motion, as well as to assess end feel, which, if you guys recall, is the feeling at the end of the structural limitation of the joint. So I'm going to move to the unaffected side. I know you can't see this side, but I'm just going to ask Lisette, just relax and let me take you through that motion. Let me know if anything doesn't feel good or if it hurts. And I'm moving her hand up towards her shoulder to elbow flexion. Great. And for her, I felt a bony end feel at the end of elbow flexion. Some people for elbow flexion might have a softer end feel if they have very well developed biceps. I'm now going to assess passive range of motion on the affected side. So Lisette, can you turn your palm up towards the ceiling? Great. Now just relax this arm. I'm going to take your hand up towards your shoulder just like I did on the other side. Please let me know if anything hurts. I will stop.
It's uncomfortable.
That's
right
uncomfortable there? Okay. So this is where I'm going to be stopping for her passive range of motion. And I can observe that that is limited compared to the unaffected side. Now that I have done that, I'm ready to actually take my measurement. Again, before I even use my goniometer, I want to ensure that all the bony landmarks I need for alignment are exposed. So I know that I need to be able to visualize her acromion. So I'm going to roll. Are you okay if I roll up your sleeve?
Yeah.
Okay. Great. So I know that my stationary arm needs to align with her acromion. I know that the fulcrum needs to be at the axis of the joint, which is the lateral epicondyle of the humerus. And my moving arm is going to align with the radial styloid process of the wrist or of the forearm. So I'm going to align this goniometer. And you may have seen in the past in some of your observations where therapists have actually pushed the goniometer onto a person's skin. That's actually not best practice. It's not very sanitary, and it can also deform and bend the goniometer and impact your measurement. So try your best when possible to keep the goniometer at least an inch or two away from the person's skin. The other thing to note with the elbow flexion measurement is that some people might have some elbow hyperextension. If somebody has a lot of elbow hyperextension, you can place a towel underneath to place them in more of a neutral position, or just start your measurement from that neutral position. For any goniometric measurement, it's really important that you start at 0. It's not appropriate to move a person and try to guess with your goniometer and just put it up against that person. You want to start the measurement from the 0 position. Okay? Now we realize that you don't have quite enough hands to hold the goniometer in place exactly and move the person through passive range of motion. But what we need to see is that you align appropriately at 0, then move the person, and then you can chase, what we call chase with the goniometer after. So I'm going to palpate her acromion. I'm going to line up the axis with the lateral epicondyle and align the moving arm with the radial process of her forearm. So I'm at my 0. Now I'm going to take her hand up through, and here I am meeting an end feel. And I'm going to read this measurement on the outermost numbers of the goniometer. And I am seeing 93 degrees. I'm going to take her back down to that 0 position. I'm going to take 2 more measurements because we're going to take the average of 3. And I am getting 90 degrees. And I have to be mindful because my proximal arm wants to scoot back a little bit, so I have to make sure I realign a little bit in each measurement, and that is okay. And this is my last measurement. 92 degrees. Coming back to 0. So those are my 3 measurements. I would take the average of those 3 numbers, and that would be my measurement for left elbow flexion passive range of motion. And I would record that as 0 to 91 degrees of left elbow flexion passive range of motion. When you record passive range of motion, you don't want to just say 92 degrees of elbow flexion. You actually want to indicate that you started from your 0 point, and that it was 0 to 92 degrees of left elbow flexion passive range of motion. It's important to make sure you document what type of range of motion you performed, because in some instances you may measure active range of motion clinically. But this was the process for measuring passive range of motion.